you already own. Because remember, as a member, you are the owner. So thank you. Enjoy the presentation tonight. Everybody have a nice evening and a safe drive home.
Thank you. Excellent. So as you know, we are recording this event, so you can always go and find it online at speakers.roseman.edu. If I could ask you to silence your phones, because that helps with everyone's concentration and interruption. And with that, I'd like to introduce our speaker. Dr. Mandal is a Fulbright scholar and professor at Roseman University College of Pharmacy. He received his PhD in science from Jadavpur University in India and did postdoctoral research at the University of Chicago and University of Michigan. He held research faculty positions at the University of Michigan College of Pharmacy and Virginia Tech's College of Veterinary Medicine. He conducted vaccine development research at the University of Michigan and biodefense research at Virginia Tech. He was awarded a Fulbright specialist appointment by the U.S. Department of State's Bureau of Education and Cultural Affairs and World Learning in 2019. In 2021, the Fulbright Foreign Scholarship Board awarded the scholarship grant to teach a course on infection, immunity, and immune-based therapeutics to the bachelor's and master's students at the Birla Institute of Technology and Science in the Palani, Goa campus in September 2022. Dr. Mandal teaches immunology to our students who are pharmacy students and also our dental students. With his expertise in immunology and viral vaccine research, he developed an elective course on COVID-19 infection, immunity, and vaccine. He has been interviewed many times by local TV stations, radio, and newspapers on COVID-19 infection, variants, and vaccines as a subject matter expert. So he's a local celebrity for sure. An international celebrity. Dr. Mandal has published peer-reviewed research articles in major immunology and pharmaceutical journals and book chapters. He has served as an editor for scientific journals and a reviewer for scientific articles, grants, and professional society meeting submissions and awards. He lives in Henderson, Nevada with his wife and 2 daughters. He loves photography, gardening, and nature. Please join me in welcoming Dr. Mandal.
Thank you, everyone. Good afternoon. And thanks, Vanessa, for that very lengthy, kind introduction. I always tell you, cut it short. Just say my name, that's sufficient. But anyway, and thanks to the Clark County Credit Union for sponsoring this event, like all other events. Many of you, I see familiar faces here. And once again, thank you for coming in this evening. Let's learn about vaccines. The title is kind of misleading with this word emerging, meaning what we will be learning, not all the infections that we will be talking this evening and learning, can they be prevented with vaccines, are emerging infections. But certainly there will be many infections in those lists that qualifies for that. So that's a first little bit of disclaimer prior to beginning of my talk. Following our Roseman's model of teaching, we always begin to teach our students about what is the end goal. So what we'll be learning, how vaccines do work through immune protection. Then we'll look into several different infections, notably COVID-19, monkeypox, very recently RSV, respiratory syncytial virus, influenza infection, and few other infections. And what are the vaccines that are available, specific for providing protection against those infections? Then I will touch a little bit base on newer approaches or developments on tuberculosis and malaria, although these two are not the infections in North American population, yet we will examine that a large number of individuals loses their life worldwide annually due to tuberculosis and malaria. And we will end this talk touching on HIV, human immunodeficiency virus infection. Unfortunately, still there is no vaccine available for HIV, but there have been improvements and strides into controlling HIV infection. We will also touch at the very end on that area. So let's begin where all these things began several centuries back. In the top panel, what we see here is British physician in Glasgow, Dr. Edward Jenner, in 1796. He made a very seminal observation. What was that? Very simple, yet very seminal. At that time, milk used to be delivered by milkmaids coming to household in buggies, and they will carry few glass bottles filled with milk and drop at the door of the household. Around 1796 and many years around that, in that century, smallpox was a very dreadful disease. It almost eradicated half of the European population. And in that time, Edward Jenner, the physician, observed that through the pox pandemic, this lady comes to my home to deliver the milk, and she goes house to house throughout the neighborhood and in the town, yet she is not infected with pox. That is the seminal observation. He also observed that this lady has some pustules, nodules on her hand rather. He asks, where did you get these pustules from? The lady milkmaid answers, oh sir, or sire, whatever the language would be, I have observed them when in the cow's udder when I milk the cows. Connection was made by Edward Jenner. This woman, through milking the cows, getting something in her body that is making her resistant to human pox virus. That was the simplest observation that led to the first demonstration that you see up there on the top right-hand side panel. Dr. Jenner isolated through syringe little bit of those pustule-specific fluid, injected himself, injected a boy, then deliberately exposed themselves going to a house with pox virus infection. And they were protected. They never developed the disease. Thus, the first scientific demonstration of the principle of immunization or vaccines or vaccination generated or developed in the world. Although in ancient literatures, in all civilizations, including in Asia and India, China, Middle East, Western civilization, there were references about concept of immunization or vaccines, how it protects one against infections. But this was the first scientific demonstration that yes, if we pre-expose someone to a pathogen without causing the illness or pathogen-specific antigen or molecule without causing the illness, that would generate most likely a protective immune response for future infection. About 100 years later, Louis Pasteur, down below, the French scientist, improved on and came up with vaccines against rabies, anthrax, and cholera. Fast forward in 2020, we had COVID-19 vaccines developed, released, and that ultimately controlled the current pandemic. Last September in 2020, September around that time, a newer version of COVID-19 vaccine, which is called a hybrid vaccine, was developed and introduced into the market. Maybe some of you have gotten it, but I missed my chance. Before traveling to India, I wanted to get a booster dose, but it was not released yet. So I still got the original vaccines booster dose. And I traveled twice last year to India at different time points throughout the year. And for my work and conferences, I traveled quite extensively in last 1 year throughout US and outside. I never contacted infection. With a mask on and with vaccines and booster dose of COVID-19 vaccine, I remain protected. So that's the triumph of vaccine. Let's discuss this whole idea looking into other areas of infection, meaning. So yes, they were there at that time. Well, so the word vaccine comes from pertaining to cows. Vacca in Latin is cow. The experiment I described that Edward Jenner did, the observation that cowpox antigen could provide protection against human pox virus, that's the derivation of the word vaccine. So at that time, even folks thought that if we get a vaccine, we might get turned into cows. So vaccine hesitancy, anti-vax movement is nothing new. We have seen that before. So how it works? Essentially, when we take a vaccine, immunization, it generates immune response. What is immune response? It activates some white blood cells in our body. Who are these white blood cells? T and B lymphocytes, or T and B cells. They become activated or stimulated and goes to work. B cells will make antibodies. Those antibodies will circulate in our plasma and wait there. If I ever get exposed to the same pathogen microbe in future, they will protect me, neutralizing that infection. The other white blood cell population, T lymphocyte, also gets activated through vaccination and through infection. Both T and B cells gets activated. But the safer way to trigger immune responses is through vaccination. Ultimately, through the combined action of T and B cell, we will generate antibodies, we will generate small molecules such as cytokines. Some of the T cells would go into killing mode, killing virus-infected cell types or even cancerous growth in our body. Then what will be remaining cell types, those white blood cells, will be memory T and B lymphocytes. Yes, not only we memorize things, meaning we are capable of memorizing, but some of the cell types in our body are also capable of memorizing something. What do they memorize? They memorize the structure or how those vaccines or vaccine antigens looked like. So in future, if they see similar structures through an infection in our body, those memory B and T cells will jump and go into action very quickly. That's why we needed to get booster doses to combat the Omicron variant through a bivalent vaccines of COVID-19. So that's the kind of overall how vaccines do work in general in our body when you take the vaccine shots. Next month is Global Health Day. World Health Day, April 7, 2023. The vaccination and immunization is a drive, is a movement worldwide, meaning if we can protect each and everyone against vaccine preventable infections and diseases, then perhaps we will not experience another pandemic in our lifetime. Just imagine, in about 3 years back, what started in China, in Wuhan province, that ultimately spread all over the world and brought the world down to its fate, shutting down everything. And collectively, as a human civilization, we never experienced, we did not have a living memory of another pandemic. Last one was 1918. Maybe someone is still alive, but almost none of us has a living memory of a pandemic. So we just coming out through lifetime experience of going through a pandemic. And yes, we should be all collectively proud of our achievements that we've been able to defeat this pandemic in 3 years through vaccination. So who leads the vaccination charge for all over the world? WHO, who celebrates World Health Day, April 7, 2023. And the goal is health for all. And immunization and vaccination is the keystone to achieve that goal. Because infections can generate anywhere in the world. But if we have effective vaccines to contain those infections at the point of origin, then perhaps it would not transmit worldwide and bring another pandemic to us. That's the goal. There are many numbers and data, but essentially immunization improves national and global health. Who are the institutions? In US, CDC, Centers for Disease Control, its counterpart ECDC in Europe, and worldwide, WHO, they are the responsible agencies to come up with a formulation guidelines to deliver vaccines and immunization worldwide. And they're the sources of major funding also. In essence, vaccines do save life through eradication and prevention of infectious diseases, and also it reduces secondary infection due to a specific disease condition, meaning many individuals died due to COVID-19, but many more perhaps died due to secondary causes due to COVID-19 through cardiac episodes, through pneumonia, through respiratory failure, many of those disease conditions, and many patients could not get their cancer treatment. Those data are not really readily available yet, but ultimately what clinicians and scientists are getting at, due to COVID-19, a large number of lives were lost, but maybe equally or could be slightly more lives were lost due to COVID-related episodes. We still do not know those data. So that's what it refers to: eradicate and prevent infectious diseases and reduce secondary infection. But we can prevent all those incidences through immunization and vaccination. And down below, these are the numbers: smallpox, diphtheria, measles, rubella, through tetanus. And through 1920s, through 48s, when those vaccines were introduced, those were the numbers, and currently they were almost negligible, non-existent. Only vaccines could do that. No medication, surgery, or any other medical interventions do have that power to eradicate, control a disease from the face of Earth. So how vaccines overall work at a population setting? There's a concept called herd immunity. Herd immunity refers to if majority of us in this room who are present here right now, we are vaccinated against COVID-19 or many other infectious diseases, then some of us who cannot get those vaccines, they are also protected, meaning majority, when they're immunized, they will not catch the infection, thus they will not be transmitting the infection. That's the concept of herd immunity, on which the vaccination and immunization protocols are best worldwide. There is not a hard number, but short of if over 80%, close to 90% population in a society, in a community are immunized against a specific vaccine infection through vaccination, immunization, then rest of the individuals, 20 to 30% of the individuals in that community or society who may not be able to receive the vaccines or medically or physically not competent, there could be many reasons, they are protected. That's the goal for any immunization drive or vaccination protocol. But unfortunately, it has been achieved, except mumps, measles, and rubella vaccine, MMR vaccine. That triggered a real good herd immunity, and that's one of the gold standard of immunization and vaccination. So again, vaccine works through eradication of the disease, such as smallpox and polio. Those two infections have been eradicated from the world through immunization. That's the success story of vaccination. Prevention of infection, COVID-19, MMR, diphtheria, tetanus, malaria. The new vaccine have been developed for malaria. Reduction in secondary infection, even we can prevent cancer through HPV vaccination, such as Gardasil. Human papillomavirus is responsible for cervical cancer in women. When that has been observed, then scientists created human papillomavirus specific vaccine, which is called Gardasil, and few other names are brand names and generic names are there. Gardasil is given to pubertal girls who shots 6 months apart, so that they are prevented from getting human papillomavirus HPV infection. Thus, they will not develop cervical cancer in their lifetime. when it was observed that girls get those infection, boys transmit those infection into the girls through contact. Currently, Gardasil has been advised or recommended to be given to the boys also. So vaccination not only prevents infectious diseases, but there is clinical evidence that vaccines can prevent cancerous development also in us. This is a very striking data set. We have vaccines for many vaccine preventable diseases, but still there are deaths from vaccine preventable diseases, such as tuberculosis tops the chart. About 1.18 million individuals die every year worldwide due to tuberculosis. Tuberculosis does not impact that badly to US population, but other than US, in sub-Saharan Africa, in Asian countries, and many other and South American countries, tuberculosis is a killer disease. So taken together, about 1.5 million people worldwide die, even when we have vaccines available for those infections and diseases. And who bears the largest brunt of those deaths? Children. 700,000 children died of vaccine preventable infectious diseases. And where those children's kids live? Low to poor, low income countries. That's a real story. And flip side is that if those children received immunization or vaccines that are commercially available, if their government, their society could afford and distribute and deliver those vaccines to those children, they will be alive. Health benefits, there are many health benefits of vaccination. Without going through the details, the striking point is estimated to prevent about 4 to 5 million deaths per year. In the context, COVID-19 took about little over 1.1 million American lives in just last 2 to 3 years. But every year, that many deaths are prevented through immunization protocols. It saves 386 million life years and 96 million disability adjusted days globally, meaning infection not only makes one sick, but it compromises life. It compromises ability to work. Sometimes someone can be crippled. That's what it refers to. Also, when a nation and a community is in good health, then they are more productive, more prosperous. And that's the story of American prosperity. With good vaccination, immunization protocol availability, we have conquered many infections in our society. So what are the vaccine preventable infectious diseases? Some of these diseases, there are many others. Some of these diseases we will touch in next few slides. We'll begin with COVID-19, then monkeypox, RSV, respiratory syncytial virus, touch a little bit on influenza, then end with polio, tuberculosis, and malaria and HIV. And on the right-hand side panel, this panel shows the pneumonia, influenza, and COVID-19 mortality as of January 19, 2023, meaning if you just follow the red spike, that's the percentage of death due to, that's in short known as PIC, pneumonia, influenza, and COVID taken together. And before 2019, it was at the baseline. Then with the advent of COVID-19, then it started spiking up, going down, then again there was a spike. And finally, we have been, the down below this graph shows the 2023 data, it has been under control and going around the baseline again. Meaning COVID-19 not only killed people through COVID-19, but it also triggered other infections, such as pneumonia and influenza at a heightened level. That exaggerated the death above the baseline very significantly in last 2 to 3 years. Fortunately, that is going to the baseline again, meaning exaggerated or heightened deaths have been mostly averted through COVID-19 vaccines and controlling the COVID-19 infections. These are very recent data as of March 2023. These are few notable countries who showed the heightened infection as of March 31st last year. These are the numbers or graphs in the numbers: Germany, United States, Italy, United Kingdom, Canada, and India. But fortunately, all these countries are showing very baseline infection. COVID-19 is not gone. It still exists in the community, in the world, but it is now an endemic disease, meaning a disease, respiratory infection that are prevalent in many societies where many people are not vaccinated, or et cetera, et cetera. So this graph gives us hope that through vaccines against COVID-19, we've been able to conquer this pandemic and bringing down it into making an endemic disease. So what are the numbers? Without going through all of these numbers, totally 69% of the US population got primary series COVID-19 vaccines, and below, at or below 5 years of age, this number is a little higher, which is very good. And aged elderly individuals over 65 years of age, their immunization percentage is really very impressive, over 94%. Because these are the individuals early on the course of infection were mostly impacted and lost their lives. The number with people with those who are the primary series immunization that was released in the market around January 2020, 21 and onwards, and people with bivalent booster doses, that number is slightly lower, and it is expected because by the time this updated bivalent, what is a bivalent booster? It is a newer mRNA vaccine that added Omicron variant specific sequence on top of the original vaccine. That's the bivalent booster in short. That immunization data is slightly less than desirable, overall total about 16%, but people over 65 years of age, they have reasonably high number of 41% of them got this bivalent booster dose of vaccines. So taking all this data together, down below on the right-hand side panel, from year 2021, these are the spikes in the infections, and eventually those spikes went down as of March 8, 2023, few days back data. And if we compute all these numbers out of COVID-19, the inset, that's the spike. Unvaccinated individuals lost their lives, whereas the down below line, infection in the vaccinated individuals. And that's the triumph of vaccine. Overall, people who got vaccines against COVID-19, they remained very highly protected. It's not that they did not catch the infection. They as well got, many of them unfortunately were infected, because this vaccine was not developed to prevent transmission or infection. This vaccine was developed to prevent serious illness due to infection, hospitalization, and death. And in those categories, this vaccine performed absolutely with full marks. This inset data essentially demonstrate that fact, that this vaccine did its job well. So COVID-19 is a global infection. That's why it's a pandemic. Many agencies, CDC, Centers for Disease Control, and COVAX initiative, that initiative refers to worldwide initiative consortium that brought all the countries, leading players of COVID-19 vaccine manufacturers together so that they can come up with a pledge that we will donate our excess vaccines from our stockpile to the countries where COVID-19 vaccines are not readily available, they are not the manufacturers, and they do not have the economic resources to bring those vaccines in their country. Yet, there is a tale of vaccine inequality. Down below, this data shows high-income countries, they actually hoarded the highest amount of vaccines with them, way in excess, that can be utilized by the citizens of their country. Then comes the middle, upper, lower, and low-income countries are the least available COVID-19 vaccine countries. There comes the COVAX initiative, is a global initiative through which US, European Union, UK, Japan, Australia, and Canada, they placed and donated at least significant number of those numbers of vaccines, COVID-19 doses, to the people of the world who could not simply afford to have a COVID-19 vaccine through their own government's purchase power and et cetera, et cetera. So this initiative is a pivotal movement globally that actually instrumental to control COVID-19 globally. Because we have to again remind ourselves that these infections, even that originates in a very obscure place in the world, maybe we do not know that place's name, does not matter. It will eventually soar up in our country and may as well bring ourselves down to our knees and shutting down everything. This type of initiatives has the power to stop the transmission at the onset. A little detailed science, how COVID-19 vaccines work is a mRNA vaccine, and when that we got the vaccines inside our body, T cells, B cells, they got activated. Ultimately, through B cells, we generated antibodies, and T cells became activated, generating ultimately, as I mentioned before, memory T and B cells. That remained our hallmark of protection against future infection. And regarding the updated vaccines, simply it added Omicron variant specific sequences on top of the original spike protein sequence for the original virus. What is a variant? Variant is a mutated version, a newer version of the original bug. That's all about it. Sure, it changes its structure so that it can survive. It's a tug of war between a pathogen and us, the host. If I am vaccinated and the pathogen remains the same, the pathogen would not be able to infect me. So how the pathogen survives in the world, in the nature? They change themselves. They become clever. They add some, they delete some materials from their body so that my white blood cells that remember the old original pathogen does not recognize the new one. So to combat that, scientists came up with an updated bivalent vaccine that had the original spike protein sequence added with a newer Omicron-specific spike protein mRNA sequences. That's the bivalent vaccine, and it works very well in preventing Omicron infection in the country and worldwide. So that's all about COVID-19. Let's move on to a couple of other infections that made a little bit of stir in the, at least in the news channel last several months, such as respiratory syncytial virus, RSV. This is an old virus infection, not a really emerging infection, but we never had a vaccine against it. Who get impacted? Elderly people, over 65 or so, and very young kids, about 1 to 2, 3-year, 5-year-old kids. Usually when we get RSV infection, respiratory syncytial virus, it's another respiratory virus, we clear up the infections pretty well within a couple of weeks. Majority instances, we do not need treatment, do not need anything other than isolation, home care, and rest. But some kids and some elderly population may be vulnerable towards RSV infection, and it can kill someone. And there has been an increase in RSV and RSV-associated emergency department room visits and hospitalization in US in 2022 and 23 season. About 2 to 3% of the children infected with RSV require hospitalization. Good news is that Moderna, Pfizer, and GSK very recently developed COVID-19, means not COVID-19, RSV-specific vaccine. They were working on this project for the last several decades. Came up with vaccines against RSV, 3 companies, at least 2 of them submitted their data. I have friends and acquaintances who work with FDA, and they told me that, yes, they received the files, they are actively reviewing it, and hopefully sometime later in this year, RSV vaccine will be released. So that will add our protection, one more vaccine to fight a disease that impacted us over after over. That's a new story, and that's a very encouraging story, right direction in the development of vaccine. Because RSV, although is not usually fatal, but can be fatal in children and elderly population in some instances. Flu. Flu is a household name. Many of us get annual flu shots. How many of you got your flu shot this year? All of us, including me. 100. So which is good. But we often underestimate what influenza can do to us, meaning how severe ill one can become through influenza infection. Again, in certain patient population, particularly elderly, patient with chronic obstructive pulmonary disease, COPD, asthma, they can be very vulnerable to flu and flu-associated illness such as pneumonia in their lung. Yearly, about 45 to 60,000 North American patients lose their life due to influenza and influenza-associated infection. That's a large number, actually. Good news is that, and these are the data down below. And influenza-associated pediatric deaths, 2019-20 and 2020-23 season, it was a little lull in between because when we all wore masks and we all were confined into our homes for last about 2 to 3 years, influenza did not impact us because it's transmitted through contact, through respiratory sneezing, coughing, and catching someone, those droplets. And that's how we get influenza infection. So when we wore a mask, not only it protected us against COVID-19, it also cut down influenza virus infection in us. But it's in the upswing a little bit. Everyone thought that this will be a very bad flu season. Fortunately, it did not turn out to be that way. And we have good vaccines against influenza, and we should take our annual flu shots just to keep us protected against influenza, because influenza can be deadly in certain individuals. Another infection, viral infection, monkeypox, scared many of us sometime about last fall through early this year. What's monkeypox? It's an old virus that existed in the nature, like SARS-CoV-2 existed in nature. At some time point, these viruses that originally found in wildlife, wild animal in nature, when we go too much close to wild lives and nature and handle them not really right way, these infections jump the species, meaning they jump from animals to human. That's called zoonosis. That happened to trigger monkeypox virus infection. It's an old virus found in chimp, in monkeys, particularly in West and Middle Africa, African countries. But when individuals in those countries, they catch those animals, sometimes they kill them for their food or have them as their pet and etc. Those viruses gets into human being. That's the story of monkeypox virus scares that happened about 3 to 6 months back worldwide, actually. Usually, this is a self-limited disease with a clinical presentation that almost resembles smallpox infection because it's the same family member. It's not a different virus. Smallpox is a human virus. Monkeypox is a virus, pox virus that happens found in monkeys, in animals. Severe cases can occur, and a case fatality ratio, meaning how many cases and out of those infected individuals, how many will die, that's not very insignificant, 3 to 6%, but majority infections were contained in certain individuals who has certain lifestyle choices. Human transmission can occur through close contact with an infected animal and in close contact with lesions, body fluid, respiratory droplets, and contaminated towels and sheets through human to human transmission also did occur. Good news is that smallpox virus vaccine that would provide about 85% protection against monkeypox virus. Sure, there was a vaccine available and vulnerable group of individuals were advised to take a vaccine that would protect them. Specific vaccine for monkeypox virus, JYNNEOS, requires 2 doses of vaccination and approved for the prevention of monkeypox in 2019. And it's still available in the pharmacies, in the clinic, with the health departments. And people who are most vulnerable, they're advised to take 2 shots to remain protected. And these are the numbers down below. In US, about 30,000 with 38 deaths. Globally, it's about 86, 90,000 individuals recorded with monkeypox virus infection. But fortunately, it came down very quickly and under control. Again, through public awareness and through vaccination. Let's look at polio. Polio is not a disease in US anymore because we have good polio virus vaccines. But worldwide, polio is still a disease and a dreadful disease. So 2023 was the target year for interrupting all remaining poliovirus transmission all over the world through poliovirus vaccine delivery and immunizing the kids worldwide. 2 countries remained the hotspot for poliovirus transmission and remained as a reservoir, endemic reservoir for poliovirus, which is Afghanistan and Pakistan. But through a massive efforts of Bill and Melinda Gates Foundation and World Health Organization, CDC, and many other organizations, as of now, technically, those 2 countries do not have active poliovirus infection. Therefore, this is the year poliovirus has been declared to be eradicated from the world. Although it does exist at many, many discrete, distant pockets in many countries of the world, not exactly exclusively those 2 countries, but overall, poliovirus infection has been eradicated. Again, a triumph of vaccination. And the country who led the charge in developing poliovirus vaccine is US. University of Michigan, University of Pittsburgh, and many other institutions were pivotal. All the poliovirus vaccines, Salk and Sabin, those 2 scientists who won the Nobel Prize for developing poliovirus vaccine, that did happen in US many years back. And the first vaccine, poliovirus vaccine, was developed through public funding. March for Dimes, you all know that, right? I did not grow up here, and I'm not. So you know that March of Dimes was the concept. Every elementary, middle school, and high schools in this country at that time used to have a box where parents would send their kids to the classroom to drop a dime. Those monies were collected throughout the country, and that paid for poliovirus vaccine research and developed poliovirus vaccine in this country. That is the triumph of vaccine. Last few slides on tuberculosis, malaria, and HIV. These are the data. 1.5 million people died from tuberculosis in 2020. 0.6 million from malaria. About 0.7 million worldwide died due to HIV. Are there any vaccines? Yes, tuberculosis do have vaccines, but it's a very old vaccine. The vaccine was developed called BCG, Bacillus calmette-guerin. It is a vaccine not given to US population because tuberculosis is not a disease for US population, citizens. But this is a vaccine given outside US. As I grew up in India, I got my BCG shot to protect me against tuberculosis infection. But this is not a good vaccine. it provides somewhat partial protection to children against tuberculosis infection early years in their life, but almost no protection into the adolescent and adult years. So tuberculosis still exists, and it is a very difficult disease to cure and treat. Therefore, there was a renewed research went on all these years, and this vaccine is at least 60-year-old vaccine, and the pathogen was isolated from a cow, not a human pathogen. But still, that is the only vaccine, approved vaccine against tuberculosis. So WHO goal is a world free of tuberculosis, zero death, ending TB epidemic by 2030. It's a lofty goal, but scientists are working for last several decades tirelessly. And finally, perhaps there are some hopes. A newer vaccine, MVA-85A, entered into clinical trial in a span of about 50 years. But unfortunately, through the clinical trial, the data came out that it did not offer any significant increased protection compared to the existing BCG vaccine. But the fight goes on. Scientists in the labs all over the world, including Johns Hopkins here, Walter Reed Research Center here, they are working to create a new tuberculosis vaccine. And in the context, tuberculosis is the leading cause of AIDS-related deaths, even in US, meaning when someone finally diagnosed as HIV-infected individual becoming acquired immunodeficiency status, they lose their fight when they develop various cancers, various tuberculosis, pneumonia type of infection. So there is a value even for US population citizens to have a better quality tuberculosis vaccine. Malaria, another killer disease, doesn't impact US citizens, but malaria takes significant lives, about 0.6 million deaths, 0.62 million deaths worldwide in 2020, with a 240 million infections. Children under 5 accounted or estimated 80% of all malaria-triggered deaths. So WHO's universal malaria prevention is through surveillance, vector control, diagnosis, treatment with malaria-treating drugs, hydroxychloroquine, that was mistakenly used to treat COVID-19 early on, and development of a vaccine. We are very fortunate. Scientists at Oxford University developed a reasonably good vaccine that entered into clinical trial, and that showed 80% protection, protective efficacy through very recently concluded clinical trial. Hopefully, this vaccine will be mass produced, and one of the manufacturers in India, who is actually the largest vaccine manufacturer in the world for any vaccines, including pediatric vaccines given to every kids in the world, which is Serum Institute of India, they picked up this vaccine manufacturing responsibility. The vaccine was developed by scientists at Oxford University General Institute of Vaccinology at Oxford. So hopefully in next few years, vaccine will be mass produced and delivered throughout the world, bringing malaria down. Finally, few moments with HIV. Unfortunately, we don't have vaccines yet. That's the truth. Reason? Many. HIV is a notorious viral infection that changes its structure very often, quite frequently. Also, HIV infection is sort of a technically intracellular pathogen that grows inside CD4 T cells. It becomes very difficult to develop a vaccine that is growing inside a cell type in our body. Although all the viruses do grow inside our body, means in a specific cell, we have vaccines against other virus infection, but for various reasons, we have not been able to develop a vaccine against HIV. So the focus shifted on transmission prevention, how we can prevent transmission from one HIV-infected individuals to another. Through testing, treatment, and prevention, that's the current protocol to fight against HIV. Newer drugs been developed to treat HIV infected individual. Trogarzo is a good drug developed and released a few years back, now available in the market. What it does, it treats very well into HIV drug-resistant individual, meaning HIV-infected individuals are treated with a combination of 2 to 3 antiretroviral drugs together. But at some time points, many of them develop resistance towards those antiretroviral drugs. Trogarzo is a good drug that targets CD4 T cells. That is the reservoir of HIV infection. And this drug also prevents the vertical transmission of HIV-infected mom into its children, offsprings. Even more recent drugs such as Cabenuva is another antiretroviral drug. Very recently, it's still in TV commercials. That has been released, and it is proving to be more powerful than existing antiretroviral drug. So taken together, early testing, prevention mechanisms, and these treatments will keep HIV as a manageable viral infection. And after detection of HIV, now the lifespan of HIV-infected individual is 30 years, 40 years. But there will be a time when none of these drugs will work in that individual. There is some hope. Very recently, there has been some reports of HIV cure. This is the third individual in the world in New York City, a woman who was treated with a bone marrow transplant, or actually a stem cell transplant, was ultimately cured. She was treated with stem cell transplant to treat her leukemia, but through that treatment, she was also HIV-infected individual. Her HIV was undetectable. She is the third individual to go through similar protocols, either bone marrow transplant or stem cell transplant. Essentially, what happened in these 3 individuals, so these patients are not identified. She is referred to as New York patient. There was an Amsterdam patient, there was a London patient, because their identity was heavily protected, because this is something even the clinician scientists do not understand completely. But what we understand is that those transplant, either a stem cell or a bone marrow transplant, brought some mutated white blood cells in those patients' body, and those mutations were located where HIV binds to. Therefore, if I take away the docking site, anchoring site, I cannot dock my boat in the harbor. That's what happened to them. So if you imagine there are harbors in Lake Mead, there are pillars where you tie your boats. Imagine we have a boat, someone is bringing the boat to the harbor, but those pillars were taken off. There is nowhere I can tie up the boat. So those mutations were in those pillars, so that HIV could not bind to those individuals' white blood cells further. After bone marrow transplant, after stem cell transplant. So there is hope, but it might take decades to come up with a similar mass treatment protocol or an effective vaccine against HIV. So let's summarize what we have been learned so far. Vaccines are the most cost-effective medical interventions to prevent infections, and that also improves our individual and global health. Routine immunization is the foundation for strong, resilient health systems and universal health coverage. When we talk about public health system, universal health coverage, immunization, vaccination are the capstone. They are the pillars, because such is the power of immunization and vaccination. We need to build on immunization progress following COVID-19. Yes, we have lost tremendously in the last 3 years, but we have learned tremendously. Never in the history of vaccine development or immunization, a vaccine from the conception to the market has been developed in less than 3 years. Usually it takes 10, 15 years when a vaccine can come to the market if it is successful. I'm a vaccine researcher. Usually it does not work. If it works, it takes minimally 10, 15 years from research starting in the lab, then completing the phase 1, phase 2, phase 3 clinical trials, and into the vial available at our pharmacies or at our health department. But this time it was no less than a miracle, because I know what it takes to develop a vaccine. I have spent 25 years of my life trying to fiddle around those things. So that's the progress in the context of COVID-19 in the realm of vaccine research and vaccine development. Because almost overnight, scientists created a fantastic platform, which is called mRNA platform, that can be universally applied to develop many other vaccines, because we know the sequences. Sequences mean genetic materials of almost all the pathogens that infects us. Following that conversation, currently Moderna, Pfizer, and many other companies are developing a combination of COVID-19 vaccine will be added with seasonal influenza vaccine. It's just addition of beads on a string, on a thread for individual infections. And that is not a distant dream. Those clinical trials already started. Most likely in next 2 to 3 years, we have a combination combo vaccine that protects us, that will protect us against COVID-19 and influenza, maybe RSV in future. So that's the progress we have made through COVID-19 vaccine research, but we still need to address the gaps in vaccines and immunization through affordability and accessibility, meaning vaccines on the shelf is not synonymous with vaccines in the arms. There's a huge difference. Generation manufacture of vaccines will happen. Got to ensure that people who needs it, they can afford it. They have access to those vaccines. So we need to create infrastructure for efficient and equitable vaccine delivery and vaccination, address vaccine hesitancy. Also, COVID-19 brought other aspects in this whole story. Overnight, many of us became very knowledgeable how vaccines work, why we should not take vaccines, etc. But we never, for a minute, we thought that we all grew up having vaccines. That's why we are here today at this age. So we need to have that conversation. It's nobody's fault. Actually, if there is a fault in this story, fault perhaps lies to people maybe like us who understands the science but never been able to communicate the science clearly to the public. We could have done a better job. That needed to be addressed and implement public health policies overall to improve vaccination, keeping us healthy. Thank you very much. I appreciate your attention today.
Any questions? If you could take the mic if you have a question, because that's why with the recording, we'll pick up your question.
Yes, one of the viruses that's most common that you didn't address is the cold viruses.
Cold viruses,
And
yes.
it looks like I've been reading immunology publications. It seems like mRNA is suitable for cold viruses. Do you see that happening anytime soon?
It's a very good question. Yes, I did not address because there is no vaccine for it to prevent us. The hurdle against developing a vaccine against cold virus is not a single virus. That's the first.
Yeah,
We know that. Second is that whenever the vaccine or any drug is attempted to be developed and manufactured, etc., away from the philanthropic and good consideration, goodness consideration, major consideration, will it make enough money? Why COVID-19 vaccines were developed in 2 years? US, European, and other government, WHO, Gates Foundation spent billions. That B has a tremendous impact. So unless that B is ensured, I personally don't see a cold virus specific vaccine initiation will be underway and a product will come out and be available for us. And other way to answer that question is that we usually clear up cold virus infection without much episodes, meaning it does not usually become severe and no significant fatality. involved in it. So taken all these considerations together, perhaps a better way would be if we can have a cold virus specific antiviral drugs, that perhaps will be better option, because that will control the viral replication. When someone gets exposed to the family of cold viruses, it's a rhinovirus family of viruses, and patient will take a home rest for a few days, be a little miserable, but eventually will get over with the viral infection without needing to be vaccinated or immunized. That's the way I personally see.
Okay, now going on that same vein,
Yes,
there have been some articles in some of the immunology press
you're right.
that the 1892 Russian flu virus has become one of our common cold viruses today. Do you see that same trend happening with COVID and SARS and MERS?
Viruses do mutate. They are very clever inert particle, because unless a virus gets in my body, they do not have any life. Sure, all the viruses, either they are found in wildlife or somewhere in Russia or India or China or Africa, eventually got to get into a live system. That live system can be a human being, can be an animal, and as human beings move much more compared to the 18 some eras, we will make those viral particles more movable through flights, through travels, trains, buses, flights, ships, etc. So it might as well would happen. And the current COVID-19 story supports that. No matter whether it has been developed in a lab in Wuhan or the wet wild market in Wuhan was the source of the release, eventually it did spread. And that spread would happen for other viruses, other infection, almost guaranteed, inevitable. What prevents us? Solid policy, taking the preventative measures. If it's a respiratory virus, wear a mask. It's a barrier. It has no political color. It doesn't do anything. It simply protects me against exposure. That's all it does. As I stated, with a mask, I traveled almost other part of the world for 40 hours. I wore KN95 mask. It was painful. As I entered US airport here, until I landed my hometown in Calcutta in India, 3 plane changes, waiting for at least 10, 12 hours taken together, I wore the mask. With vaccine and with the mask, I did not get exposed. I remain protected. Sure.
No, but
These
the
types of-
question I was aiming at was, is COVID going to become more contagious and less virulent over time? And look
Okay.
like the it looks like the Russian flu became a much less virulent cold.
Usually, two things happens. I got your exact question now. Two things happens in the context of virus infection or any other infections. They spread. Through the spread, they mutate or change, and with the change, it's a double-edged sword. They maintain their infectivity. At the same time, they become less and less virulent. That strategy was observed by scientists early on, who started adopting that strategy in the laboratory to start generating avirulent strains of pathogen to develop the early vaccines. Pass a pathogen from culture 1 through culture 100th or culture N, which was a virulent pathogen in the initial culture. By the 100th passage of the culture, the same pathogen loses its virulence. So yes, it will become less virulent. That is actually demonstrated. Some recent articles, when they looked at overall, you are very right, COVID-19 lost its steam of infectivity, infection capability, as it mutated in infected more individuals. At the same time, it lost its virulence. That has been clearly demonstrated by the recent Omicron and Omicron subvariants XBB 1.5. Yes, so that is true. But that's a good point.
Questions? Any other questions?
how do you see stem cells being worked into vaccines?
Stem cells directly going into the vaccines is a long shot. Theoretically, ideally, yes, we can change the genetic contents of a stem cells derived from umbilical cord or from any other sources and put that into an individual where it would confer resistance, because stem cells do have the white blood cells seeds in them. They are called pluripotent hematopoietic stem cells, big name, but essentially all the cell types in our body are derived out of those stem cells. Problem is that although we are all human beings, you and I are different genetically. Due to our race, due to our parents, we all differ in our genetic composition. We all carry the genes, but they're subtly different in their expression, in their protein level between you, me, and someone else. Therefore, that is the greatest hurdle. Even scientists can create stem cell-based vaccine, it would not be universally applicable to everyone in the world. That is the greatest hurdle. But the technology exists today. So that perhaps is the greatest hurdle there.
Anyone else? Okay, can you hand this back for me?
Would you talk about malaria and different ways that we can bring an end to it? I'm thinking about gene drive in mosquitoes, in addition to vaccines, in addition to bed nets, and we could do them all at the same time. We could walk and chew gum at the same time.
Yeah, that is a bioremediation approach. People are working on it, not only for, so to begin with, malaria is a vector-borne disease. Vector-borne disease refers to it's transmitted through insect bite, meaning mosquito bite. Mosquito is the reservoir. One infected mosquito bites from one to the next person, transmits the malarial infection. So the protocol or the pathway you described is the, can we change some of the genetic elements in that mosquito that presumably could be infected, carrying the malarial parasite in them, so that they would not be able to harbor and transmit the parasite when they bite another individual. That has been tried and is being tried. One approach, that approach is called bioremediation, meaning biologically we make this mosquito inept, incompetent to carry malarial parasite in them. Unfortunately, not been successful yet. Another bioremediation strategy was even more simpler. Release small fish called guppies in the small streams or the canals or the drainage system outside US, where the drainage systems are not very good, many stagnant water sources and etc., where the mosquito actually breed and they leave their larvae and etc., acquire malarial parasite. Those guppies would eat those larvae. That's another form of bioremediation. There are treatments such as chloroquine, hydroxychloroquine, that treats malaria well. There is a bed net sprayed with insecticide. That's another way. And the vaccine I have mentioned, that is the greatest hope right now because it really did well in the clinical trial. Hopefully in next 2 to 3 years, it will be used for mass immunization to begin with the children in sub-Saharan Africa, then will be extended. So malaria is a very complicated disease. It has stages in mosquito, in human being, and then again transmitted when a mosquito bites an infected human being and then moves towards another human being and bites the uninfected human being to transmit the infection. So it has life stages in mosquito, in human being, it's very difficult to create a very single, easy solution to prevent the infection. Even with the new vaccine that has been developed to control malaria, it would not be 100% effective. Scientists, clinicians also already knows that. But if it reduces the transmission and the severity of the disease at a significant level, that is the achievement, and that's where whole approach towards controlling malaria is working. So it would not be a single focused attempt that will be successful to control malaria.
Anybody else? Oh,
Okay,
she's back.
one more.
She's back, one more.
Can you talk about schistosomiasis? What are your ideas?
Schistosomiasis, again, not in here in US population. It's in South America or in Asian countries. There are no, these are sort of orphan diseases, unfortunately, meaning not a large revenue generating market to develop vaccines against these type of infections. And it is not a primary interest in the Western drug manufacturer, pharmaceutical industry, but locally, WHO and many other specialized health centers in the world, like London School of Tropical Medicine and Hygiene, etc. Here, Johns Hopkins or Walter Reed Medical Research Center, they work on these infections and disease condition, but I personally do not know of any data, at least on the vaccine approach to control schistosomiasis or many other parasitic infection elsewhere in the world, because primarily, unfortunately, it's not an infection in North American, European population. So there are not much to talk about the advancement of the therapy and in the vaccine development approaches in these many of these disease conditions, which is not desirable, but that's the state of art.
I'm just going to give this gentleman at the end a moment to talk because he's not yet asked his question.
Thank you. Doctor, is any vaccine 100% effective?
The best effective vaccine is MMR vaccine. You know that, we know that. It confers about 90 plus 98% protective. No vaccines in that context is 100% protective. The gold standard is MMR. Yes, please.
Yes, there's been a new announcement about these RNA interference treatments and maybe a vaccine. I guess the first venture funding happened Tuesday.
Okay, that's improvement. Against what disease or what is the disease they're targeting?
Oh, they're targeting many diseases.
Many diseases, but it's a platform. They're RNA interference, small RNA interference. Yeah,
Yeah, and it attaches to your.
yeah, I understand the technology. Yes.
You do, okay.
Yeah.
It seems to last a long time from what they are saying. It can go to sleep in your cells and last.
Yes. So
decades.
how it works, a few years back, the lady who won the Nobel Prize in chemistry, she developed a technology called a CRISPR technology. CRISPR technology uses an enzyme, Cas9 enzyme, that was very instrumental to develop even mRNA vaccine against COVID-19. So silencing an mRNA, which is a precursor of a protein in our body, means I'm talking, walking, everything is done through developing or generating proteins in our body. So diseases happen in our body overall when there is a malfunction of many of those proteins. Either they are not generated well, or they are generated overtly, or they are misfolded, wrongly generated. Then we get infections. For example, when we don't have enough insulin, we become diabetic. Or when the insulin receptors develop resistance for the insulin that we generate, one becomes type 2 diabetic. So the question is that, can we correct those protein products overall, looking globally to target different disease conditions? Theoretically, yes, we have the technology through those Cas9, CRISPR technology, and many other technology. But the elephant in the room in that conversation is that how we can make it really off-the-shelf medicine, meaning scientists have demonstrated that silencing an mRNA can, if not cure, can actually treat it very well in the animal model, in the lab setup. But can we make that happen as off-the-shelf medicine, meaning there will be a vial for the treatment of type 2 diabetes or type 1 diabetes, one get a shot and the mRNA has been silenced or upregulated. Either way, if I know how to silence someone, I definitely know how to make that person talk also. It's kind of reverse in that sense, scientific sense. That's the real challenge in this scientific approach, that how we can make it universally applied, universally adapted or adopted, so that person A and person Z, both or all in between, can get that same shot, because there are, again, slight differences in the sequences in our body based on our immunogenetics. Hopefully that will be overcome through those heightened and venture funding type of initiatives moving forward, but the technology exists today, that's for sure. It has been clearly demonstrated that yes, we can silence some genes that leading to the disease development, particularly cancer will be the disease that will be targeted first through this gene silencing, or some of the metabolic diseases, autoimmune inflammatory bowel disease type of diseases will be targeted first through this gene silencing protocol. It is doable. Let's hope that it works.
You talked earlier about donating vaccines to other countries,
Right.
and it has not been successful in some countries because they have no infrastructure for cold chain.
Right.
If we could donate infrastructure for cold chain, that would help a lot, but otherwise it's not very helpful, I think.
Yes.
To talk about that.
Yes. So that's a very good point. I wish I could show those. So there's a phenomenal visuals came through COVID-19 worldwide. For example, what comes to my mind, in India, there are remote Himalayan villages in the foothills of Himalaya, Chinese border, and etc. Someone was crossing a footbridge, crossing a river, and it's a bamboo footbridge, not a drivable bridge, with a cold pack on its back, crossing the bridge to go to a village where no vehicle can go into, because it's not accessible by road. And what that cold pack on the person's back carry? COVID-19 vaccines. Sure, it has been an issue. Absolutely, yes. Can we create better infrastructure? Answer is yes. It all depends on the public health policies adopted by the governments all over the world. Funding. Oftentimes we cite the non-available funding or resources are the hindrance. But in reality, actually the government's will, creating an infrastructure, creating public health institutions at a very heightened and a very strong level that is operational, and we can mobilize those infrastructures at a very short notice. That's what lacking. But yes, those cold chains are necessary elements, and people became really very ingenious, meaning in absence of a refrigerator, people created thermocol boxes and put ice packs and ice in those thermocol boxes. That became the cold chain for transferring, taking vaccines from point A to point B, many parts of the world, and it did work. So imagine in those villages, if someone puts a solar panel, that can power a small refrigerator. So those small interventions, innovations, adaptation can lead to solve these problems. But it has been noted, those infrastructural requirements, improvements are absolutely necessary all over the world, because again, even someone in that remote village in India starts an infection that we do not have it here. It's only a matter of time before that travels from that remote village through airports to US and all over the world. So that is the way to actually control or put a barrier against the transmission of those infections. But
It's a matter of education.
it's a matter of education.
You showed one slide, which I think is critical. The discrepancy in the percentage of people that receive the dose
Yes.
to those that receive the boost
Yep.
is enormous.
Yes, enormous.
The issue is that many, first of
Yeah,
all,
we
the
don't.
whole issue of the COVID-19 was politicized. And, but in addition to that, the issue that the success that the RNA
Vaccine.
had
Mhm.
led to a lot of people a sense of complacency. They don't need a booster because
They don't need a booster. Yes, that's the slide. So education is a integral component in this whole conversation, that yes, we know a lot of things, we can do a lot of things, but how we can transmit that information, provide that information at a layman's language to the community. Because I do this for 30 years, but I don't expect anyone else to have been knowledgeable in these areas, because they know something else better than me. So there is a gap in communication. There are many articles that show that what exactly you said, the communication and policies and education. No, we all failed. It's just not finger pointing, but we all failed in that context, how we educate people. So 1 minute, 1 second. You mentioned very kindly that yes, celebrity, it was, my whole thought is that I was in my office in 2020 March. I teach in our Utah campus, travel back and forth about a month. My flights were booked, my hotel was booked, car was booked, flying out of Las Vegas, going to Salt Lake, stay there for a week, come back over the weekend. I do that every year. This year I completed that after a span of 2 years. Suddenly, US travel is shutting down on March 14th, 2020, 15th or something. Within 2 days, I had to transfer my teaching mode onto Zoom and etc. Then after I finished my teaching, a thought came to my mind, what I can do, how I can contribute to the pandemic in our lifetime, which definitely I have not seen before and none of us has seen before. That was my inspiration or trigger point. I learned, I developed a course, and so-called, as I learned, I could provide that information to the people, to the community, through my talks, through my interviews, seminars, and we all volunteered in the COVID-19 vaccine clinic for first 3 months in the Valley when no one else was immunizing. So that's how we work with the community, providing them the knowledge, the information, the help, the treatment, vaccination, immunization through an institution like Roseman. That's our responsibility to the society. Thank you.
Thank you, Dr. Mandal. Thank you all for coming.